So yes, hello everyone. So am I audible so that we can start the session? My dear aspirants, let me just check. Yes, so I am audible and everything is fine. So we can start the session now. So actually functional component and nuclei of cranial nerve is a very important topic, and so we should study this in detail. And for understanding a cranial nerve, it is very important that the basic concept about this functional component and cranial nerve should be clear to you. So this is an important topic if we are going to appear for the NEET PG 2022 examination. So let me start with this topic. Before that, meanwhile, the aspirants must be joining. I would like to tell about myself and about the platform. So myself, Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College, Pune. And I have got a total of 9 years of teaching experience. Now let's talk about the special class features. When I am talking about the special class feature, it's an interactive session where the learners and the educators can interact. Okay, and polls are conducted and you can participate in the polls and you can ask your doubts right itself when the session is going on. So this is another important benefits of joining the free platform of Unacademy. Response to your poll in a better way. Talk to your educator in live class and get your doubts clear right itself when the session is going on. Never ever miss a session. This is another benefits which can be targeted by you. Actually, what is that? When you start seeing the sessions on the free platform. So you like the session, you start following the educator on the Unacademy app, and thereafter you will get notification regarding all the sessions taken by that educator. So this is another point which is very and highly beneficial for you. Once the session is finished, PDF notes can be downloaded. That is another point which is highly beneficial. You can revise if any of the point or the contents you have missed out, you can revise it. Anytime, anywhere, read from the top educators of Unacademy platform. And the aspirants joining the session for the first time, they can use the code ANAT10 to unlock the session. So I would also like to give you the information regarding the session. So let me talk about the session. So exactly the next free special class. Today also I have taken 2 special free sessions on the Unacademy platform, and I want to give you the information regarding the upcoming session which will be occurring on Sunday. So please note down, the next session will be on Sunday, that is 30th of January, 1 p.m. and 2 p.m. 2 sessions I will take of 45 minutes each. So you can be present for this session. You have to download the Unacademy app. So firstly, download the Unacademy app from the Play Store, find your goal. So your goal will be NEET PG, and thereafter you will get notification regarding, you will get the link of free sessions. Dr. Monalisa you can search on the NEET PG platform, or otherwise you can be the part of the free session by joining the link which is provided in the Telegram group of Unacademy, and also the link will be provided in all the groups and will be highlighted. So via that you can join. Now, I would also like to share this. This is the free test PG calendars. So, this is the whole January session in which you should not miss any of the test. Okay, you should be present for this test and you should be using the code. You get enrolled for this test by using the code ANAT10 and be present for all the sessions if you are going to appear for the NEET PG examination. Now, plus subscription, all 19 subjects are completed in a very systematic way. You can study from the top educators of Unacademy platform. You can compete in live tests and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs made by the top educators of Unacademy platform, and also a detailed description to each and every part of the MCQs will be provided by the top educators, and a detailed explanation will be provided. And coming soon is the printed notes of Unacademy with 1 year of subscription and more. Iconic subscription. So when I am talking about iconic subscription, it means the benefits of 2 important platforms. One is the Unacademy and the other is Prep Ladder. Already we have talked about the plus platform of Unacademy and the benefits we have discussed. Other than that, the benefits of Prep Ladder can be also assessed by you. What does that mean? That means that you will get the benefits of clinical integrated essentials, video lectures of Dream Team of the Prep Ladder, QBank 3, active guidance, rapid revision, snapshots and treasure dream notes. All these can be availed by you, and this would be acquired by you by using the code ANAT10. You get an extra discount of 10%. So these are the benefits which can be acquired by you. Congratulations to the topper of FMG December session. So I am very glad to share their images with you because I am happy that they have acquired a very good number in this competitive exam, and I wish them good luck so that they can target the NEET PG examination in the first attempt. Now, I would also like to show you the pricing detail of Plus and Iconic. You can have a comparison of the costing pattern of Plus and Iconic for different years, and then you can decide which subscription you should go for. You can use my code NAD10 to get an extra discount of 10%. Now, highly effective QBank is there, and we know that more than 25,000 MCQs are there on the platform of Unacademy. So, you can avail this opportunity. You can get a latest pattern of examination MCQs of all 19 subjects, and you can solve it, and you can get a detailed explanation given by the top educators. Use this code NAD10 to get the subscription and an extra discount of 10%. My dear aspirants, I am very glad to share the Republic Day special offer for you for the Plus subscription. You get 6 months of free extension applicable for 1 year and more, and it is applicable from 25th, 26th and 27th. That means till tomorrow it is applicable. So go for it, take the subscription of 1 year or more and get an extra 6 months of free extension on the Plus subscription of Unacademy. Use the code NAD10 to get an extra discount of 10%. So for taking the subscription, it is very important that you should know the currently which batches are going on. The currently Focus FMG batch 22 and Target NEET PG 22 MCQ batch, 2 batches are right now going live. Use the code NAD10 to get an extra discount of 10% and take the subscription. Now, let's start with the functional component and nuclei of cranial nerve. Okay, let's start with the topic now, that is the functional component and nuclei of cranial nerve. So, my dear aspirants, this is a very important topic, and the understanding of this topic is very important because often in the competitive exam MCQs are directly asked from this topic. So before starting the study of cranial nerve also, it is important that we should have an idea of functional component and the cranial nerve nuclei of each of these functional components. So before starting exactly this topic, I just want to give you an introduction about the cranial nerve. So all of you must be knowing that we have got altogether 12 cranial nerves. So this fact must be known to you. So we have got 12 pairs of cranial nerves. Now, my dear aspirants, if I talk about these cranial nerves and if I talk about the cranial nerves emerging, so only the first and second pair of cranial nerve is emerging from the forebrain, but rest of the 10 pairs of the cranial nerve, that is third, fourth, fifth, 6th, 7th, 8th, 9th and 10th are emerging from the brainstem. So first and second pair of cranial nerves emerges out from the forebrain. So rest all cranial nerves, that is third to 12th cranial nerve emerges out from the different parts of the brainstem. They emerge out from the brainstem. So these cranial nerves are emerging out from the brainstem, that is the third to 12th, but rest all, that is first and second pair of cranial nerve emerges out from the brainstem. Okay, so yes, now my dear aspirants, yes, it is a well-known fact that I would like to show you that image also. Can you see here? So see here, this is the diagram. This is a schematic diagram to make you understand from the part of brainstem. We know the brainstem is consist of midbrain, pons and medulla, and we can clearly see that third, fourth, fifth, 6th, 7th, 8th, 9th, 10th, 11th and 12th. These all cranial nerves are emerging from the brainstem different parts, and only first and second is emerging from the parts of forebrain. So I would also like to show you another image where you can see the magnified view. So here called olfactory nerve for the sensation of smell, optic nerve for the sensation of vision is emerging from forebrain. Rest all, that is third, fourth, fifth, 6th, trigeminal, facial, auditory, glossopharyngeal, vagus, hypoglossal and accessory nerve. All these nerves are emerging from different parts of the brainstem. Actually, we have done with the topic of brainstem in one of the session in the month of December, and I have already described detailed anatomy of brainstem and about the cranial nerve. Today, our goal is to know functional component and the nuclei. So this was just a brief introduction. But before that, I just want to tell that actually, yes, we all are knowing that we have got 12 pairs of cranial nerve. So can anybody tell me, is it exactly that we have got 12 pairs of cranial nerve or any new nerve is emerging? So actually a small pair of nerve which is lying very close to the olfactory nerve is called as the 13th pair of the nerve. This nerve is called as 13th pair of cranial nerve. So actually different, still some of the research is there remaining. This is the 13th pair of cranial nerve, which is also called as zero pair of cranial nerve. So this cranial nerve is lying very close. So still research is going on, and we are at to know that what is the exact function of this cranial nerve, but the location which is found. The location of this cranial nerve is lying very close. It is lying close to olfactory nerve. The other name of this 13th pair of cranial nerve is, it is also called as, it is also termed as nervi terminalis. Okay, so this 13th pair of cranial nerve also designated to be the zero pair of cranial nerve called as nervi terminalis, lying close to the olfactory nerve rootlets, is attached to the cerebrum exactly posterior to olfactory stria. Actually it is lying very close to anterior perforated substance. So this 13th pair of cranial nerve is lying close to anterior perforated substance, which is lying in the basal aspect in the base of the brain, and the function which is related to it. So function, actually it is chemosensory, and it is also affecting the pathway of olfaction. Actually it is having the function of smell mediated sexual behavior. So the function attributed to this 13th pair is smell mediated. It is a sexual behavior. So at more of research is there, and then it will be well established the function, but it should be known that the 13th pair of cranial nerve is emerging out, and it is called as nervi terminalis. Now let's come to the exactly what is the goal of today's study is to know the functional. The today's study is exactly about the functional component. Now my dear aspirants, as I told you, this is the most asked topic for your competitive exam, that is the functional component. Functional component of cranial nerve. Now, so actually for proper understanding of the functional component of cranial nerve, it is exactly linked with the development of the brain. So I would like to give you a brief introduction about the development and how the functional component of cranial nerve is formed from the beginning. So we will discuss slightly the embryological aspect. So for understanding functional component of cranial nerve and also the arrangement of cranial nerve, development of functional component is important for you to know. So firstly, I would like to tell that during the initial phase of development of spinal cord, we know that it is developing from the neural tube. So during the development of spinal cord, there is a formation of longitudinal groove in the lateral wall of neural tube, and this will divide the lateral wall of neural tube into two parts, and these parts are called as the basal component and the alar component, which is again motor and sensory. So let's importantly write this development of functional component. Of cranial nerve. So when we are talking about this topic, the most initial point which has to be understood is, I would like to go more primitively, that the function that how the neural tube is forming spinal cord. So we will not go in the exactly development of spinal cord, but in that process we know that lateral wall, in the lateral wall of the neural tube there is appearance of longitudinal groove. So write down, during development of spinal cord, there is appearance of longitudinal groove. There is an appearance of longitudinal groove, and this longitudinal groove is appearing in the lateral wall of the neural tube. It appears in the lateral wall of neural tube. Now my dear aspirants, when a longitudinal groove is formed in the lateral wall of the neural tube, it will divide the lateral wall of neural tube into two parts. So it will divide the lateral wall of the neural tubes into two parts. So let's talk about these two parts. So, okay. So this is actually called as, and this lateral groove is given a term, and the term which is used for it is sulcus limitans. Can you see here? So what you are seeing here, that sulcus limitans is appearing in the lateral wall. It is the lateral wall. So it is appearing in the lateral wall of the neural tube, and it is dividing the lateral wall of the developing neural tube into two parts. Into how many parts? Two parts. So we will again come to this diagram after further explanation. So the first step, we will go systematically. So the first step is that the lateral wall of neural tube is divided into two parts. Now these two parts are termed as, so these two parts are termed as anterior and posterior, that means ventral and dorsal. So the two parts formed in lateral wall of neural tube by the appearance of which structure? The structure which I have shown you in the diagram. The appearance of which structure, my dear aspirant? The appearance of, by the appearance of sulcus limitans. Which structure is appearing? The groove is termed as sulcus limitans. So the groove is termed as sulcus limitans, and it divide the lateral wall into two parts. One is called as the dorsal part, and the other component is the ventral part. Now here, my dear aspirants, the dorsal part is called as alar lamina, and if we talk about the ventral part, it is called as basal lamina. Basal laminae. Now, my dear aspirants, further adding to it, the cells of the basal lamina are motor and the cells of alar lamina are sensory. So please write down here few important points. So if we talk about, so dorsal, the cells of dorsal lamina, the cells of dorsal, when we are talking about the cells of dorsal lamina, they are sensory. Okay, so let me use blue color for sensory. Okay, the cells of dorsal lamina are sensory and the cells of basal lamina are motor. The cells of basal lamina are motor. Got it? Is it clear till now? Is it clear till now, my dear aspirants? Now, further development occurs, and with the further development, the cells, these cells will get arranged in the functional component or column in the lateral wall of the spinal cord. So when we move from ventral to dorsal, what do you mean by the word ventral to dorsal? That means when we move from anterior to posterior, the arrangement of these cells from ventral to posterior will happen in the form of two functional components. So together, how many functional components will be formed? So together it means 4 functional components is formed. Okay, so see here. So again moving to this diagram. So again I am moving to this diagram. See here, what I told you, the arrangement. So here the arrangement of, so as we move from ventral to dorsal, okay, as we move from ventral to dorsal, that means this is the ventral part and this is the dorsal part. Okay, so in the dorsal component we have got afferents, that is sensory. We have got the sensory functional component. The arrangement of cell will form 2 components in the dorsal aspect, and that is called as the alar lamina. In the alar lamina, this is the alar laminae, and in the in the ventral component there will be the basal lamina, and in this basal lamina, which is motor, there will be the formation of 2 components, that is general, visceral, efferent. So efferent for motor and that of afferent for the sensory. So this will happen as shown in the diagram. This will happen as shown in the diagram. So let's write it. So all of you please write this point. The cells of these 2 lamina, the cells of these 2 lamina are arranged into longitudinal column. So the arrangement occurs in the form of longitudinal columns in the lateral wall of the spinal cord, and it will lead to the formation of 4 functional components. This will lead to the formation of 4 functional component or column, both are similar, in the lateral wall of the spinal cord, and from ventral to dorsal, the components are, okay, the components. So let me write 1, 2, 3 and 4. Okay, the components are general, somatic, efferent column, general, somatic, efferent column. Then we have got general, visceral, efferent column. So firstly the motor component for the efferent columns. Then we have got general, visceral, afferent. So visceral component will be closer to the sulcus limitus. So general, visceral, afferent column and general, somatic, afferent column. So that means till now how many functional component is formed? So till now, my dear aspirants, till now the formation of functional component, we have got 4 functional component. Till now we have got 4 functional component formed. Till now we have got 4 functional component formed. In this 4 functional component, we have got 2 motor and 2 sensory. In this 4 functional component, we have got these 2 are motor component and the other one, these 2 are the sensory component. So till now is it clear to everyone? Okay. Now further what happens, certain changes occur. So till now we have got 4 functional component, 2 motor and 2 sensory. Now after that further development of hindbrain occurs. Actually the functional component and the column which is developing is related with the development of brain also. So first thing was with the development of spinal cord, the differentiation which is formed in the lateral wall is leading to the formation of 4 functional component. जब further development होता है, for the next important point, when the hindbrain is developing. So when the hindbrain is developing, what will happen? So there is 2 significant events which is taking place. One is that the neural tube which was like ventral to dorsal, the arrangement of neural tube. So neural tube was widening. The neural tube will become widened by the formation of 4th ventricle, and as a result the alar laminas are splashed out as opening of book. Okay. So it will get widened like an opening of book. So firstly the arrangement was ventral dorsal, now the arrangement is medial and lateral. Okay. So what changes is occurring? Okay, I got an answer. The lateral wall leads to formation of basal annular under these 4 functions, 2 visceral and 2 somatic. Garima Bajaj, absolutely correct, dear Garima, you are absolutely correct. So till now we have done with the 4 functional component, 2 visceral, 2 somatic, or you can say 2 motor and 2 sensory. Yes, you are absolutely correct, Garima Bajaj. The next important point is that we have got the neural tube is widening. Okay, now the neural tube is widened by the formation of 4th ventricle, and these neural tube will widen like the arrangement was firstly ventral to dorsal, and now it is widened like opening of the book, and now the arrangement of functional column is from medial to lateral. Okay, so please write down the first change. So I would like to explain the first change. Please write down about this first change. So during development of hindbrain, 2 significant events occurs. So next step is during development of hindbrain, 2 significant changes occurs. 2 significant changes occurs. So let me firstly write about the first significant changes. Let me first write the first change which occurs. The first change is neural tube widens. The neural tube widens to form 4th ventricle cavity. So this is the cavity lying in between the cerebellum and the pons and the medulla. Okay, cerebellum dorsally and ventrally, pons and the medulla. As a result, what will happen? The alar lamina. The next step is the alar lamina is opened, is you can say splashed apart. It is opened or splashed apart as is alar lamina is opened up like a opening of book, like an opening of book, and there will be, this will lead to directional change. So this significant change will lead to directional change, and the functional component now undergo directional changes. So there will be a directional change, which is the first change, and the arrangement from functional component from ventral to dorsal will now change to medial to lateral. Got it? So this was the first change which is seen with the development of hindbrain, and at that time, as the development is going on, meanwhile there is formation of, there is also, so let me talk about the second change. This is the second change which is happening. So we have done with the first change, let's talk about the second change. So the second change is that there is also head and neck structures is developing, and pharyngeal arch are forming. So due to the development of pharyngeal arch, there is appearance of an extra branchial or special column, which is exactly appearing between the somatic and the visceral column. Absolutely correct, Garima. So till now we have got visceral and somatic column is formed. Now in between the visceral and the somatic column, the next important thing which is seen is there is an extra special column that is called as branchial column, which is formed in between somatic and visceral due to the formation of pharyngeal arches. So write down the second change. The second change is an extra branchial or pharyngeal or special column. Special column appears between somatic and visceral column. Somatic and that of visceral column. In both alar and basal lamina. In both basal and alar lamina. Okay. So why is this appearance of extra special column? So this extra special column which is appearing is giving supply to, it will supply which structure? It will supply derivatives of pharyngeal arches. It will supply derivatives of pharyngeal arches. Okay. Now, apart from this, one more change happens. Apart from this, there is one more change which is happening, and extra special somatic column appears in the most lateral part of the alar lamina, and this addition of functional component is for hearing and balancing function. Okay, so apart from this, extra special somatic column, appears in the most lateral part of alar lamina, and this is for the function of hearing and balancing. So what does this mean? That means a total of how many functional component is now formed? This means a total of now 7 functional component is formed. Okay. So, so a total of 7 functional component is formed, and so let me just enlarge this diagram to help you to understand. We will, okay, so see here. So this will lead to the formation of 7 functional components. So just see here. So what you can see, this the first change which I told you, that opening is like due to formation of 4th ventricle. The arrangement of functional component is from medial to lateral. Okay, so there is, this will be dividing, as you can see, the motor and the sensory one. So yes, so see here. So medially to lateral we will see the arrangements. So I am just, this motor component with red and sensory component with blue. Okay, so altogether how many? 7 functional component is formed. 7 functional components are formed, or the column is formed. Okay, see here. Now, So as we move, so let's see the components. So see here, the three motor one is general somatic efferent, special visceral efferent and general visceral efferent. These three are the motor component. Other than that, we have got the sensory component. The sensory is general visceral efferent, special visceral efferent, general somatic efferent, and the lateral most is the special somatic afferent. Sorry, all these are afferent. So these are all sensory. So together we have got 7 functional components. How many? Together we have got 7 functional components. In this 7, 3 is the motor and the 4 are the sensory. So is it clear? This is what happens. Okay. So I would like to write the name and then we will move on with the nuclei. So altogether 7 functional column or component is formed in the brainstem. And these are general somatic efferent. Then we have got the special one, special visceral efferent. Then we have got general visceral efferent. Then we have got general visceral afferent, special visceral afferent, general somatic afferent and special somatic afferent. Okay. So here these 4 are sensory and these 3 are motor. Now with further development what happens? So till now we have got the 7 functional components. So till now we have got these 7 functional components. As the development proceed, these functional column which is formed here will develop into one or more discrete cranial nerve nuclei with the further development. So when the further development occurs, these functional column or the component which is formed will lead to formation of one or more discrete cranial nerve nuclei. Discrete cranial nerve nuclei. So are you understanding? Okay. So yes, this is what happens. Now the next important point is to know the cranial nerve nuclei. So I would like to tell you the cranial nerve nuclei according to each of this functional component. So there is one or more nuclei formed in each of this functional component. Okay. So yes. So for that, firstly I would like to show you this diagram and then we will proceed. Is it okay? Yeah. So see here, this was how many component we have got? 7. So this is the first, this is the second, this is the third, this is 4th and 5th is together, this is the 6th and this is the 7th. So these are all functional component. What are these? These are all functional component. These are all functional component. These are all functional component. Now, okay, now my dear aspirants, general somatic efferent. When we are talking about general somatic efferent, it's a general somatic efferent functional column will give rise to general somatic efferent fibers or nuclei and which will supply striated muscles of the body wall or the limbs. So in this category we have got 4 cranial nerve nuclei, that is the oculomotor trochlear nerve nuclei, the abducent and hypoglossal nerve nuclei. When we are talking about special visceral column is actually supplying the muscles of pharyngeal arch and this is the motor component of trigeminal, facial and nucleus ambiguous. Okay, they are respective cranial nerve nuclei. When we are talking about general visceral efferent, that is forming the parasympathetic. So they are actually supplying the glands, smooth muscles of the vessels and the viscera and forming cranial outflow or parasympathetic outflow. And in this category we have got various nuclei: Edinger-Westphal nuclei, superior salivary nuclei, lacrimatory nuclei and the dorsal nucleus of vagus, superior inferior salivatory nuclei and dorsal nucleus of vagus. Don't worry, I am just showing you this diagram to make you understand. All these things I will write it for you. You can also write along with me and we will have a brief discussion of all these points. The next is general visceral afferent and special visceral afferent. These functional components are conjointly having only one nuclei. The name of that nuclei is nucleus of solitary tract. Okay, so that is a composite, that is a nuclei for 7th, 8th, 9th cranial nerve, and that is actually important for general sensation and special taste sensation. When we are talking about general somatic afferent, the 6th functional component, which is basically required for proprioceptive and exteroceptive sensation, we have got 3 trigeminal nuclei, that is sensory. So we have got sensory nuclei, that is chief sensory mesencephalic nuclei of trigeminal nerve, and the 7th one is for the function of hearing and balance. In this category we have got the vestibular and cochlear nerve nuclei. So we will talk in brief about all these nerve nuclei and functional component, and also the function and where it is located. So let's talk about individual, and then again in the end I will show you a diagram of about the location of each of this functional each of this cranial nerve nuclei. Is it okay? We will go systematically. So let's start with the first functional component. Which is the first functional component? The first functional component is general somatic efferent. General somatic efferent. So general somatic efferent. What is the function? The general somatic efferent fibers, which is arising from the nuclei of general somatic efferent column, is supplying. It supplies striated muscles of body wall and that of limbs. Basically you can say they are supplying the muscles which is developed from the somites. General somatic efferent fibers, which is arising from the nuclei of general somatic efferent column, is supplying striated muscles. Okay. In this category we have got following nuclei. So I would like to write the name of the nuclei. The name of that nuclei is 3rd cranial nerve nuclei, 4th cranial nerve nuclei, because they are for the supplying. Then we have got abducent or 6th cranial nerve nuclei, and we have got the 12th cranial nerve nuclei in this category. Now, the next important point is the location. The next important point is the location. So actually, let me just write about the location. So 3rd cranial nerve nuclei is located, the 3rd and the 4th cranial nerve nuclei is located, both of it is located in the midbrain. The 6th cranial nerve nuclei, is actually located at the lower part of the pons. To be more specific, it is exactly located beneath the facial colliculus in the floor of 4th ventricle. It is located beneath facial colliculus in the floor of 4th ventricle. Floor of 4th ventricle. Now, okay. And what about the 12th cranial nerve nuclei? When we are talking about hypoglossal cranial nerve nuclei, it is actually an elongated cranial nerve nuclei, elongated in shape, and it is occupying the length of the medulla. It is lying in the medulla in the paramedian plane. Paramedian plane. So if I talk about the function of each, so 3rd cranial nerve nuclei is supplying all extraocular muscles except LR6 and SO4. Why? Because LR6 lateral rectus is getting innervation from abducent nerve. SO4 means superior oblique muscle is getting innervation from 4th cranial nerve. 4th cranial nerve is supplying which extraocular muscle? SO means superior oblique. 6th cranial nerve is supplying lateral rectus, and 12th cranial nerve is supplying all the muscles of tongue. All the muscles of tongue except palatoglossus, muscle. So this is in brief about general somatic efferent. This is in brief about general somatic efferent functional component and about its cranial nerve nuclei. So if you want, I will show you the diagram also. So now let me just enlarge this diagram. We are talking about motor nerve nuclei, cranial nerve nuclei. So what I told you about third, oculomotor, this is the third cranial nerve, oculomotor, this is the trochlear nerve nucleus, this is the abducens nerve nucleus, and this is the hypoglossal. So yes, if you will see in this diagram, so clearly you can see that oculomotor nerve nucleus, the trochlear nerve nucleus, oculomotor nerve nucleus, the trochlear nerve nucleus, the abducens nerve nucleus, and the hypoglossal nerve nucleus. So you can clearly see the location, and what you can appreciate, oculomotor and the trochlear nerve nucleus is located in the midbrain, abducens is located in the pons, hypoglossal is located in the medulla in the paramedian position, in the paramidline position, and it is elongated. Hypoglossal nerve nucleus is elongated. Is it clear? So we have done with this. Okay. So done with this. Now let's move on to the next one, the second one. So we have done with the general somatic efferent. Now next is to know the general special visceral efferent. So next is special visceral efferent. The second functional component is special visceral efferent. So my dear aspirants, when we are talking about special visceral efferent functional column, the special visceral efferent fibers arising from the nuclei of special visceral efferent functional column will supply the muscles developing from pharyngeal arches. So it will supply the muscles developing from pharyngeal arches. Developing from pharyngeal arches. So in this category we have got following cranial nerve nuclei. The name of that nuclei are, write down. We have got motor nerve nuclei of trigeminal nerve. The location of this motor nerve nuclei of trigeminal or fifth cranial nerve. What is the location? I will again show you the diagram for it. The location is, it is located in the upper part of pons. In this category, the second cranial nerve nuclei is motor nerve nucleus of facial nerve. Motor nerve nuclei of facial nerve. So exactly, if we talk about the location of motor nerve nuclei of facial nerve, it is located in the lower part of pons. So exact location, to be more specific, if you want to know, it is anterolateral and caudal to abducens nerve nucleus. So it is anterolateral and slightly caudal to abducens, means sixth cranial nerve nuclei. Okay, so we have done with this. Now which was the third one? So the third cranial nerve nuclei is nucleus ambiguous. Nucleus ambiguous with W spelling, ambiguous with W, nucleus ambiguous. Okay. Nucleus ambiguous is actually composite nuclei for, it is also elongated in shape. I will show you the location also. It is elongated nuclei and it is also located in the medulla. It is also located along the entire length of the medulla. So it is occupying entire medulla length, and it is a composite nucleus for, please note down that it is a composite nucleus for, it is a composite nucleus for 9th cranial nerve, 10th cranial nerve and that of 11th cranial nerve, supplying the muscles of pharynx, larynx and that of soft palate. Soft palate. Is it okay? So we have done with this. Now what is next important is to know exactly the location in the diagram. So let us proceed for that. So we have already done about general somatic. We have discussed already in this diagram. Let me again highlight this. So we have already done with the location of general somatic, or this was all general somatic efferent. Now the next is the location of special we have got the special visceral efferent. So in this category, the nuclei are facial nucleus. We have got facial nucleus in this category. We have got motor nucleus of the trigeminal nerve. Where is the motor nucleus? Yeah, this is the motor nucleus of trigeminal nerve, and nucleus ambiguous. We have got 3 nucleus in this category. Again, I would like to use pink color only. This is that is red one. These 3 nucleus is the nucleus of special visceral efferent. Okay, so here you can see the trigeminal motor nucleus. This one is located in the pons upper part. Facial is located in the lower part of the pons. It is in the lower part of the pons, and it is in the upper part of the pons, slightly lying, the facial is slightly lying in the lying anterolateral and caudal to 6th cranial nerve nuclei. So this is the 6th one. Now the nucleus ambiguous, again you can see it is elongated, and it is elongated located in the medulla, and these 3 again is the special visceral efferent, nucleus of special visceral efferent. So we have done with the motor. Only the one more functional component of motor is remaining. What is it? The next which is remaining is the general visceral efferent, that is for the cranial outflow of parasympathetic innervations. Okay, so we have got one more functional component of motor category. So all motor one is shown by red color. See here, all the motor nuclei, cranial nerve nuclei is shown by the motor one is shown with red color. So let's talk about the third functional component, that is the general visceral efferent. So write down. The third is general visceral efferent. General visceral efferent. Okay. Yeah. General visceral efferent fibers which is arising from the nuclei of general visceral efferent column is basically supplying the glands, smooth muscles of the vessels and viscera. So they are basically supplies glands and smooth muscles of vessels and visceras, and they are actually forming cranial outflow of parasympathetic nervous system. Cranial outflow of parasympathetic nervous system. Okay, so let's talk about the cranial nerve nuclei in this category. So we have got following cranial nerve nuclei in this category. The cranial nerve nuclei are following, that is the first one is Edinger-Westphal nuclei. Edinger-Westphal nuclei. Okay, I will talk about the location of each. The second is lacrymatory nuclei and also superior salivatory nuclei. Superior salivatory nuclei. The fourth is inferior salivatory nuclei. And the fifth cranial nerve nuclei in this category is dorsal nucleus of vagus. Dorsal nucleus of vagus. So let me talk briefly about its location. So let me talk briefly about the location of all these nuclei. So Edinger-Westphal nuclei is located in the upper part of the midbrain. Actually, the location of Edinger-Westphal nucleus is very close to the third cranial nerve. So it is located in the upper part of midbrain, close to third cranial nerve. Okay, so see here. If we talk about lacrymatory nucleus, and so lacrymatory nucleus basically for supplying lacrimal gland, superior salivatory nucleus for parasympathetic innervations for the submandibular sublingual glands, and these two are located onto the dorsal part of pons. Inferior salivatory nucleus is also on the dorsal part of pons, but lower to the location of superior and lacrimatary nucleus, superior salivatory and lacrimatary nucleus. Dorsal nucleus of vagus is again a long vertical column located along the length of the medulla. So these 5, again I want to show you the location of these 5. So these are again the general visceral efferent we have talked about, and let's see the location of this general visceral efferent functional component cranial nerve nuclei. So yes. Okay. Now see here, Edinger-Westphal nucleus, which is exactly located, as I told you, Edinger-Westphal nucleus, as I told you, it is exactly located near to the third cranial nerve in the midbrain. So see here, located in the midbrain, component of general visceral efferent. Okay. Superior salivatory nucleus, and actually just above the superior salivatory, it is not shown here. Here will be the lacrimatary nucleus. So just close to it will be the lacrimatary nucleus, and these two nucleus, superior salivatory nucleus and that of lacrimatary nucleus, they are very close to each other, together only. These together is located in the pons, and in the slightly above the location of inferior salivatory nucleus. So all these nucleus are located in the pons. So these are all nuclei for general visceral efferent, got it? And the last is dorsal nucleus of vagus. So dorsal nucleus of vagus, again elongated, and if you will see, this elongated nucleus is exactly located between hypoglossal and nucleus ambiguous. Exactly, it is located between hypoglossal and nucleus ambiguous. This is the dorsal motor nucleus, and this is again the component of general visceral efferent. So my dear aspirants, now you can see all the motor cranial nerve nuclei we have done. So with this we have finished all motor cranial nerve nuclei. We have finished with all motor cranial nerve nuclei. What is remaining is the sensory, which I will explain via okay. So we have done with this. Okay, now let's talk about the sensory one. So we have done with this. Now let's talk about the sensory one. So one important point is that so we have done with the 3 functional component. When we are talking about 4th and 5th functional component, so when we are talking about the 4th functional component, which is general visceral afferent, and the 5th functional component, which is special visceral afferent. The important point about these afferents or sensory functional component is that these 2 functional component together is having only one cranial nerve nuclei. So 2 functional component is aggregated for one cranial nerve nuclei, and that is called as nucleus of tractus solitarius. Okay. So 5th and 6th together is having only one cranial nerve nuclei, that is again elongated column of cells, which is called as nucleus of solitary tract. The other we also called is at nucleus of tractus solitarius. Both are similar only. Don't get confused. Nucleus of tractus solitarius. And this is the composite cranial nerve nuclei for general visceral afferent and both special visceral afferent. Okay. So what is the function? When we are talking about general visceral afferent, it means it is required. This function is required for general sensation of distension. It carries the general sensation of distension and ischemia from viscera, from the lungs, from the heart, and from the upper GIT. Special visceral afferent is important for taste sensation of the tongue, carries taste sensation of the tongue, and this is important for general sensation like distension, ischemia. Now, what is the location of the nucleus of tractus solitarius? So the location of nucleus of tractus solitarius is, it is actually exactly located ventrolateral to, close to the dorsal nucleus of vagus nerve. So it is located ventrolateral to dorsal nucleus of vagus, and the location is, it is located in the medulla. It is located in the medulla. Let me show you. So this is the sensory one. So again, when I enlarge this diagram, you can clearly see the nucleus of solitary tract. The nucleus of solitary tract, which is the sensory one, exactly location is close to, you can see it is lying, the sensory one, it is lying in the medulla, and it is just located it is just located ventrolateral to dorsal nerve nucleus and nucleus of tractus solitarius. If we talk about this, this is a composite nucleus for two functional component, that is the general visceral afferent and special visceral afferent. So we have done with this. Now what remains? The next is, now we will talk about the sixth one. So we have done with general visceral afferent and that of special visceral afferent. The next is general somatic afferent. General somatic afferent, that is the sixth functional component, is exactly important for carrying two important sensations, that is general sensation of pain, touch, temperature, that is called as stereoceptive sensation, along with the sensation of vibration, muscle and joint, that is called as proprioceptive sensation. And this is, that is general somatic afferent functional component. It's important is nuclei is it's a sensory, it is actually it is cranial nerve nuclei, sensory nuclei of trigeminal nerve. So again it is having three component, trigeminal nerve, and it is having three component of cranial nerve nuclei. The two important function which it the two important function for which it is important is that it carries the function of general sensation, that is of pain, touch, temperature, stereoceptive sensation, and the other is proprioceptive sensation. Proprioceptive sensation. So proprioceptive sensation means sensation of vibration, sensation of muscle, joint sensations. Okay, so exteroceptive. So the first sensation is exteroceptive sensation. So when I am talking about exteroceptive sensation, that means receiving sensation from the external aspect, change in weather, cold, pain, touch from external aspect. Proprioceptive sensation means the sensation which is received from myon body components. Okay, so in this category we have got again we have got three nuclei. Please write down. The three nuclei are, the first is chief sensory trigeminal nuclei, The second will be mesencephalic trigeminal nuclei, and the third is spinal trigeminal nuclei. They are all sensory nuclei of the trigeminal nerve. So when we are talking about the chief nuclei, the chief trigeminal nuclei, exactly its location is in the upper part of the pons. So to be more specific, dorsolateral part of pons. And most important function which it carries, most important function carried by it is the function of tactile sensation, touch, tactile sensation. Now, so this is the function of chief. Now let's talk about the spinal one. When I am talking about the spinal, actually what happens, the chief sensory trigeminal sensory nuclei will extend in the lower direction and will extend towards the cervical spinal segment. So it extends more caudally, it will extend caudally to the second cervical spinal segment. The location will be extending till the second cervical spinal segment, and the most important function which it serve is that it is important for the function of pain and temperature sensation. So most important is pain and temperature sensation, but it also carries the touch sensation. Got it? So yes. So we are talking about general somatic afferent. Now, if we talk about the third one, that is mesencephalic, the mesencephalic nucleus is extending more cranially. So it is the extension from the chief sensory trigeminal nuclei in the cranial direction, that is it is extending to the upper part of the, it will extending upper, so it will extend into the midbrain. It is extending and going towards the midbrain, and it is required for proprioceptive sensation. So done. So So let's again see this diagram. So we have done with the 3-1, we have done with these 3, we have done with the chief sensory trigeminal nuclei, location in the pons, extension in the caudal direction is forming spinal trigeminal nuclei, extending into the second cervical segment of spinal cord, extension in the upper direction cranially, mesencephalic nuclei of trigeminal nerve sensory in the midbrain located, and it is required for proprioceptive sensation. So mesencephalic basically for proprioceptive sensation, spinal mainly for pain, touch, and also pain and temperature and also touch. Chief is mainly for tactile sensation. Now let's see the location. So again moving on to the same diagram. Yeah. So here what you can see, now let's move on to the same one. So we have got here mesencephalic nucleus, main sensory or the chief sensory nucleus, and the spinal nucleus of trigeminal nerve. Now see here, the mesencephalic, the main sensory, and the spinal nucleus of trigeminal nerve. If you can see, this main or the chief sensory is located in the pons as shown in the diagram. It's caudal. If it is moving more caudal, it is extending till the second cervical segment, as shown in the diagram. And the mesencephalic is extending in the midbrain, as you can see. Okay, it is extending in the midbrain. These are all the cranial nerve nuclei for general somatic afferent, So yes, now we are talking about the last functional component, the 7th functional component. That 7th functional component is special somatic, So okay, so that is exactly not shown here. So I will just tell you about the special somatic afferents. So let's talk about special somatic afferents. So write down the 7th functional component is SSA. What is SSA? Special somatic afferent. So the basic function carried by it is it carries the special sensation of hearing and equilibrium. So in this category we have got 2 nerve nuclei. Actually one is the vestibular nuclei. It is having vestibular nuclei and it is having cochlear nuclei. So again the cochlear nuclei will have 2 components, that is it will have dorsal and ventral part, and this dorsal and ventral part is according to its location on the dorsal and ventral aspect of ICP, inferior cerebral peduncle, which is occupying the upper part of medulla. It is located in which component? It is located in which part of brainstem? In the medulla component. When we are talking about vestibular nerve nuclei, so actually it is having 4 components. So partly it is located in medulla and partly this nuclei is located in the pons. It is located in the lateral part of floor of fourth ventricle, and it is again having 4 components. It is having superior, inferior, medial and lateral vestibular nuclei. So done. So in brief, we have done all the 7 functional components. Along with it, we have also done with the cranial nerve nuclei, location, all the sensory and the motor one. So after understanding this topic, it becomes very easy to understand the cranial nerve. So I will also take all the cranial nerves, and after understanding the functional component, it will become very easy to understand all the cranial nerves. So we will cover up that topic also in the coming session. Now, my dear aspirants, before ending the session, I would like to give you information regarding my upcoming session. So, yes, I am going to take free special classes. So, this free special classes again will be on. So, this free special classes will be taken by me on Sunday. Okay, the next session will be on Sunday, that is 30th of January. So, let me just give you the detail. So, that is on Sunday. Okay, so I will take next session on Sunday 30th January, 1 p.m. and 2 p.m. 2 special classes. So firstly, for presenting live for this session, you have to download the Unacademy app, and you have to find your goal as NEET PG, and thereafter you can be present live for this session. The unlock code is ANAT10. So do present live for this session. This will be highly beneficial. So this session will be of high yield anatomy MCQs targeting for NEET PG, targeting for NEET PG 22 examination. So do present live for this session. Sunday sharp at 1 PM and 2 PM. 2 sessions of 40-45 minutes each. So done. Timing is 1 and 2 PM. Now my dear aspirants, I would also like to tell you about the test. So I want to give you the details of the free test calendar for the month of January. So do enroll for this test by using the code ANAT10 and take the benefit of this free test platform. This will be highly beneficial for you in targeting better rank in the competitive exam of NEET PG 22. I would also like to share Republic Day special offer, which is 6-month free extension if you are going to take 1 year or more of Plus subscription. So the offer is valid from 25th Jan till 27 Jan. That means till tomorrow it is valid. Use this code ANAT10 to get an extra discount of 10%. This will be highly beneficial. So you can just grab this opportunity of extra 10% discount and 6-month free extension if you are going to take the Plus subscription by tomorrow, that is 27th January. Before ending, have a look on the comparison or the pricing detail of Plus and Iconic. This is the code ANAT10 which will give you an extra discount of 10%. And before ending, we will exactly meet tomorrow with the upcoming session, that is will be at 6 PM, and so let's crack NEET PG. I will take another session tomorrow 6 PM live of MCQ sessions, and also on future Dr. Unacademy 8 PM session. So do present for this live sessions on the YouTube, and also do subscribe, like and share the Let's Crack NEET PG platform of YouTube. Thank you, all the best, keep studying. So let's meet with the upcoming session. All the best. So if you are watching the session, what is the benefit of being watching the session on that of the platform of special classes, that you can also download the PDF notes. So these are the benefits. So do join. All the best, keep studying. Thank you so much. Hope this was useful for you, and when I will take a session of cranial nerves, individual cranial nerves, the location and the function of each functional component will help you to understand better this whole topics of cranial nerve. All the best. Thank you, my dear aspirants.